I have sisters and cousins, and when we're done talking today, I'm going to get on that phone and make sure I call. And also, I challenge my listeners to also call and start having more dialogue about these issues, because only through conversation can we have a clear resolution and change here. But I was thinking about education and how parents push their kids towards preschool and kindergarten and all that, and expect the teacher to educate the child and become that primary provider of information. And I'm wondering about diet only because quite often we think of a doctor as solving our illness and not always providing consultation on how to keep from getting ill. And so in hearing about the uterine fibroids, what can women do to prevent this, or to help themselves, or to not be victims in the process?
Well, for African American women, there is a strong genetic component. So, unfortunately, at this time, until we can develop and get to the vaccine level to try to identify families with strong histories of fibroids and someday give them a vaccine, at this point, a lot of it's genetic, and therefore, in those individuals, there's not a whole lot they can do other than just eating well, having a low body fat. As I mentioned earlier, fibroids grow with estrogen stimulation, and estrogen is stored in fat, and so the more fat you have on you, the more fibroids will be stimulated and tend to be bigger, and more likely you'd have symptoms that in the past often meant hysterectomy. So if you can keep as lean a body frame on you as possible, that's certainly something that everybody can do. Now, as I say, I commonly will see African American women in my practice with a very low body fat and very big fibroids. And in those people, they're doing what they can. It's just genetic. There's nothing, they can do about it. But for the rest of us, we can always try to eat as good as we can and keep a low body fat. It's obviously good for your heart and heart health. It's good to prevent secondary diabetes, and it also helps with fibroids. It's just one more reason to try to exercise and be as lean as possible.
Now, are there connections between fibroids and other illnesses that, based on diet, well, you mentioned earlier diabetes and such, but is there a connection between fibroids and other illnesses that come from the same lifestyle or the same gene pool, so to speak?
Well, there is some connection with fibroids and thyroid diseases, thyroid nodules, but I'm not aware there's any connection with diet. There's been, unfortunately, precious little research done on fibroids. Because they're benign, they really don't they're not high on the list for the NIH and some of the major, research houses, if you will, in the United States. The NIH has only recently convened just to even study fibroids. There's been very little research. Most of the research goes to cancer and AIDS and so forth. And so we do know it's genetic. We know the chromosome that's involved, but we have to get to the gene level before we really start understanding fibroids and how diet impacts it, and how we can kind of do more on the preventive side, which is, really lacking.
Yeah. And so you talked earlier about the lack of research at this point and such. Is there any connection to the fact that this is predominantly a woman illness, a female illness, and also one that targets a particular ethnic group? Is that a reason for less interest or less research?
Well, certainly it targets African American women both genetically and also because in general they have more body fat on them than Latino women, who have more than Caucasian, whom have more than Asian. And that's the distribution of fibroids, African American women having the most and Asian women having the least.
Right.
And as far as, access to, some of these less invasive techniques and maybe some of the knowledge about these procedures like fibroid embolization, I think there is some truth to the, disparity in healthcare. We've certainly seen it in high blood pressure and hypertension and cancer. It wouldn't be a stretch to think that there is a disparity when it comes to hysterectomy versus some of these less invasive techniques. And so we do need to educate women so that they know of their choices and know of their options, so that there will be less disparity. And but we even see, like I say, Beverly Johnson, who has means and certainly has access that as good as anyone's. She didn't get the information either. So it's the information is lacking for everyone.
Yeah. And so, again, the idea that that folks have to use their own means to maybe become more educated on their options is a good one.
I think it's the biggest. That's the key of this whole discussion, is that women need to be empowered with information, no matter what they're dealing with in their health. Today it's fibroids, and knowing that they don't have to have surgery for fibroids. They don't need hysterectomy. They can have fibroid embolization and these non-surgical approaches. That's very important. But as a general point, just whenever you're suffering with anything from a medical standpoint, it's important to take the initiative and empower yourself with information and make the best choice, because you're going to be much more ahead of the game knowing your options, rather than kind of walking blindly into a doctor's office and just seeing what your options are.
Now, I want to talk to you about some of your upcoming any informational sessions, any special events happening to spread the word. But first, one of my listeners actually emailed me, wanted to know me to tell them what is a myomectomy.
Myomectomy.
Yes.
A myomectomy is surgically removing a collection of fibroids and sewing the uterus back together. Before we had fibroid embolization procedure, a woman really only had two options. And they were both surgical, and a woman suffering with fibroids would go to her gynecologist, and the gynecologist would say, do you want to have children or not? If she wanted to have children, she would get a myomectomy, if not a hysterectomy. But now we have fibroid embolization, and women can avoid surgery altogether.
Gotcha.